Namaskar to all. Welcome to Saffron Educational and Medical Foundation, an opportunity to be your own doctor today.
Now the question, have you diagnosed? What are the different diagnostic methods available for till the date with science? First of all, whenever we talk about this type of pain, inflammation, the most important diagnosis comes over here is the patient's history, clinical history. First of all, when the patient comes to your clinic, check gait. Gait check is one of the most important thing because or check their facial expressions also. If you are in a pain, so you may not like there is little change in your facial expressions also. So when we take the clinical history, first of all we see the position of the pain or the area of pain. Exactly, see we have a long area, like it starts from the lower back to the buttocks to the lower legs also. So first of all, it is our duty as a doctor to check the exact area where the pain is. Second thing, is there any inflammation with the pain? Third thing, the onset of the symptoms is also very important. And the last but not the least, like if the pain is there, so rather that pain is radiating pain or a stable pain. Most of the cases, the pain is radiated from lower back to the leg, any place. So this is the most important thing while taking the clinical history. Apart from that, need to check the patient's weight and age. This is also one of the most important thing while taking the clinical history. Third, about the patient's routine and their disease or any other lifestyle issues or problems, like if the patient is suffering from hypertension, diabetes mellitus, high level of triglyceride or cholesterol, if he or she is on any other medications, chronic problems, any viral infections ongoing. So many things are taken in account while taking the clinical history. Now, as a naturotherapist or as a doctor, once you are cleared with the clinical history, then only you can able to diagnose the problem. After that, there are certain imagings that you can prescribe to the patient, which definitely helps to diagnose or detect the perfect position and the perfect reason about the sciatica. So this will be with the help of MRI, the very perfect diagnosed with contrast dye, CT scan and X-rays. So here X-ray is not that helpful, but with the help of X-rays we come to know about the degenerating stages or any other changes or in the injuries in your bones or any other fracture in the bone. So at least with the X-ray we'll come to know about this thing. And with the help of MRI and CT scan, we come to know the exact position of that nerve damaged, how much the pressure is there. Because of any other damage in the other nerves which are from the spinal cord, is any other reason or anything which puts pressure on the sciatica nerve, and because of that the problem is occurred or not. So this is very much clearly seen with the help of MRI and CT scan. So these are some imagining tests which your doctor can suggest you to know the perfect diagnostic of the sciatica pain. Now, how the allopathy point of view they are going to treat? See, it is quite natural, like if you are suffering from so much of pain, get irritated, depressed, not comfortable while doing your routine, obviously we need to take some type of clinical treatments which at least immediately gives you the relief. So there, first of all, if you can't walk properly, if you are really irritated, then the first thing that your doctor will suggest you is a certain type of injections which is really necessary if the case wasn't. So it will give you the temporary effect, fast effect. If after seeing the MRI and CT scan, if your doctor is agreed like this is really there's a need for immediate surgery, the damage is really very high level, the case become the worsen. So immediately they suggest you to go for the surgery also. If you're just complaining about the little bit of pain, and if your reports are not that negative, so they might suggest you some type of OTC medicine which are a type of painkillers, right? There are another therapy which is called the rehabilitation and prevention of the pain. So generally what happen, this type of rehabilitation and prevention pain is generally suggested after the surgeries or after a specific treatment. Once the symptoms are suppressed, so to not occur immediately or again, there is a rehabilitation or the prevention pain therapies are provided to you. Because the sciatica pain or the sciatica nerve problem is very much frequently occurred. There is the most chances that it can reoccur after the surgery. So your doctor who done the surgery always suggests you to take proper rest and care for the next 3 months, because there is the high chances to reoccurrence within the 3 months period. Maybe it extends to 6 months also, but still for after the surgery, first 3 months are really very much precautionary, and you have to take proper care about that. So, what is the rehabilitation of the prevention therapy after the surgery? Or you want, if you are on a alternative therapies or the natural therapies, and the symptoms are you really feel it gets subsiding, so these are again precautions things that you have to take, like avoid weight lifting, specifically for the household workers or the women's housewives, you can say, plus the persons who are in a heavy work problem, so they have to make sure avoid weight lifting. Long drives, yes, just for 5 to 10 minutes of drive is okay, but not more than half an hour, because continuous sitting position in a specific pose is really affecting or give the pressure to your sciatic nerve. So long drives or more than 30 minutes of driving is completely avoidable. Stretching exercise, no stretching. You don't know how you stretch, for how long you can stretch, and after stretching, what are the damages to the branches of the nerves. So no stretching after the surgery, or if you want to be on a prevention.